Hi, everyone. This is our group project on our health system's response to COVID-19. We'll be spotlighting various health systems across the world, and we are going to get right into it.
Overview of the health system in the United States. The USA health system follows a fee-for-service model. Some of the characteristics of that model: it has no central government agency, which means a limited government role, has a strong private sector. It follows a market-based system, so it's dependent on the market and becomes very privatized. Some of the disparities of this health system is that it focuses on acute care over prevention, which leads to a heavy focus on downstream factors of disease and sickness, rather than upstream factors in policy and programs. This system also leads to high costs, which may make it unequal for people to access and causes health disparities based on socioeconomic status. It also has two health insurance programs in Medicare and Medicaid. And a fun fact is that the United States spends more on healthcare than any other industrialized nation, yet is not the healthiest.
Overview of the health system in Canada. Canada has a decentralized, universal, public-funded health system called Canadian Healthcare. Healthcare is funded and administered primarily by the country's 13 provinces and territories. Each has its own insurance plan, and each receives cash assistance from the federal government on a per capita basis.
An overview of the health system in Mexico. So Mexico does have universal coverage, but it is comprised of a healthcare system that's fragmented, characterized by three major types of insurance. So the first is for the employed population. So this is funded by the federal government, then employers and employees pay a fee. And then second, we have a private sector tier, which is voluntary, of course, and individuals pay premiums, much like they do in the US for private insurance. And then lastly, we have social programs, which are financed by the government. And just a few facts: 5.4% of the country's GDP goes towards healthcare, but almost half of those current healthcare expenditures are out of pocket. They also have a very extensive telehealth program, which is innovative in a way for people to receive healthcare visits virtually or online.
China's universal health coverage is made up of urban employee basic medical insurance, which covers residents with formal jobs, the voluntary newly cooperative medical scheme, and the voluntary urban resident basic medical insurance, which covers residents, self-employed residents, and residents without formal jobs. There is a strong role of government influence in China's healthcare. The government provided access to health for residents, but not everyone is able to have access due to financial problems. Essentially, they are also responsible for organizing and providing service. They cover services like inpatient hospital care, primary care, mental health care, physical therapy, emergency care, and traditional Chinese medicine. For cost sharing out-of-pocket expenses, there is a co-payment for outpatients, physicians' visits, prescription drugs varies, and co-payments for inpatient admissions are higher. Safety nets are also in place for citizens living in urban and countryside areas who cannot afford premiums for publicly financed health insurance, or for the ones who cannot pay out of pocket.
In a comparative analysis of the health systems in Canada, Mexico, China, and the US, Canada, China, Mexico have single-payer, mostly publicly funded systems, where the United States has a multi-funded system, heavily privatized, but the countries appear to be culturally similar. Canada, China, Mexico have universal healthcare systems for its citizens that are funded by the federal government, while Americans, we see that 5 non-elderly Americans are uninsured. The US spends more on healthcare per person than Canada, Mexico, and China. In 2019, the United States spent about $11,000 per person on healthcare, the highest healthcare cost per capita across all countries studied. The US spends more on administrative costs, but less on long-term healthcare than China, Canada, and Mexico. Healthcare spending in the United States, however, rose from 16.3% to 17% of GDP in that same time period.
Comparative analysis of COVID-19 incidence and prevalence statistics. The United States has a high incidence of cases in October 2020 and a high prevalence case in total throughout the whole pandemic compared to China, Canada, and Mexico. Looking at the statistics to show that Canada has a lower cases as of November 14, 2020, compared to Mexico, China, and United States in total.
A comparative analysis of COVID-19 and how the different healthcare systems actually helped. So one thing in common was that they all implemented lockdowns for their countries, closed their businesses, and implemented virtual learning and working. So China, they implemented this advanced technology, and they used a lot of big data to analyze the systems that were working and address the COVID problem. In Canada, they had vaccine availability was a primary goal of theirs. So they distributed widely to the population through various initiatives, and they educated on precaution and how to steer clear of the virus in the workplace and schools. In Mexico, they kind of laid a foundation for contact tracing and were very successful at implementing mask requirements and vaccination policies. Although some of their indigenous populations were harder to reach, they were still able to vaccinate majority of that population as well. And then for the United States, a lot of us are familiar with what happened here. Our hospitals became pretty overworked with patients, and the workforce really struggled to balance that workload. Hospitals were at max capacity, oftentimes having to turn patients away. But the CARES Act was helpful in solving that at the beginning of the pandemic, helping service hospitals, businesses, and a lot of local governments.
How the healthcare systems differed. The United Healthcare Systems of China, Canada, and Mexico offered universal healthcare, which became paramount in the study of the infection for COVID-19. The US had the highest incident rate for COVID-19, perhaps due to lack of universal healthcare and costly premium healthcare coverages, which may cause people to avoid care. Access and disparities in healthcare, they play a primary role as in who gets the needed treatment and where to find treatment throughout this COVID-19 pandemic. The US lacks access to healthcare compared to Mexico, China, and Canada.
And how did the governments intervene of the four countries? Mexico incentivized vaccination to encourage people to get vaccinated or coup rate. China financially supported medical workers who were sick with the virus and refunded Social Security contributions to the public to maximize financial support. In the United States, we implemented the HEALS Act that enacted stimulus packages for relief to people who qualify. Somebody would be a laid off worker. In Canada, they implemented a Canadian emergency wage subsidy to prevent job loss and encourage rehire for laid off employees.
It's also a comparative analysis to COVID-19 processes and challenges. And looking at the numbers, we see that China has a high number of COVID-19 vaccines and national lockdown to stop the virus from spreading. The US has a quick implementation of vaccines and distribution, keeping the COVID cases low despite 2 major peaks throughout the pandemic and stimulus checks. The challenges, China closing of the city and businesses and limited financial support resulted in failure of the country's response to COVID. In early 2019, US as a hospital overflow with patient backlog, resources shortages and vaccine hesitancy of its legitimate. In Canada, federal government inability to collect race-based data during the pandemic and racial stigmatization of the vaccine has prevented minority groups from getting vaccinated, which has been a challenge for the CDC.
And here are our references. We're excited. Thank you so much for listening to our presentation. We hope you guys learned something about another healthcare system that you didn't know before. Thank you for listening.